We're going to talk real quickly about the options that anyone would have for breast reconstruction. This is not an exhaustive list, but a general idea of least aggressive to most aggressive options. We explore this more thoroughly when we meet you in consultation, but this might help you at least categorize things. The lowest level of aggression is to not do a reconstruction at the same time as the mastectomy. Technically, it's two operations together, so if you said, do I have to do two together? The answer is no. You can separate them with time. Mastectomy and then reconstruction later. Next level of aggression is what's called a Goldilocks procedure, where we take the remaining skin after the mastectomy and kind of origami it into a much smaller breast. Depending on your particular breast size, that can be anywhere from an A cup to maybe even a C, maybe. Next level of aggression would be to use what's called a tissue expander. A tissue expander is similar to a placeholder. It is like an empty breast implant with a port that we can access and inflate over time. When they do the mastectomy, the blood flow that goes through the breast to the skin is removed, so the skin is going to be a bit in shock. Oftentimes, by placing an empty device like a tissue expander, it is a bit safer. The negative is that you're going to need to have that tissue expander removed because it doesn't feel very nice, and replaced with a different form of reconstruction later. Next level of aggression, go directly to an implant. Implants are great, they're soft and squishy, but you can't use them if you're going to need radiation, right? They're so soft and squishy that the radiation may deform them. In addition, if they are big or heavy, they can end up causing problems with healing, as we just talked about by using the tissue expander. The next level of aggression is to do a combination between implants and some form of your tissue or additional tissue to put either a larger implant or because the skin is a bit unhealthy. One of the more common ones is your pec muscle or a muscle from your back called your latissimus tunneled under the skin to cover a device. That's usually kind of a backup that we use. And then the highest level of reconstruction technically is to make a breast out of just you, the most common one being the belly, where nowadays we don't take really much of any muscle, but we do find the blood vessels and trace them down until they're large enough, cut them, bring both of those up to the chest, and sew them to the blood vessels on either side of your breastbone. That is a very big technical operation involving microsurgery. It's a bit more complicated and has a bit more involved recovery. But in theory, you don't need an implant then if your belly has enough tissue. And that's just a quick overview of the options for breast reconstruction.